Hello and welcome to this UniTaster On Demand event today. My name is John Sheik. I'm here from UniTasterDays, and it's my job to introduce the event and introduce the speaker. The subject we're going to be looking at today is physiotherapy, and I'm absolutely delighted to be joined by Carley Turner from the University of Huddersfield. Carley is a senior lecturer in physiotherapy and is going to provide a guide to why you might want to consider studying physiotherapy, what to expect on the course, application tips and careers. And with that, if I pass things over to Carley Turner, joining us from the University of Huddersfield.
Thank you, John, for that introduction, and thank you for inviting me to talk about physiotherapy. So a quick introduction to me. My name is Carley Turner. I'm a registered physiotherapist and also a senior lecturer in physiotherapy here at the University of Huddersfield, and I am an admissions tutor as well for physiotherapy at Huddersfield. So I'm going to talk to you today about what is physiotherapy, what you can expect from studying physiotherapy, what the career might be as well, and some little hints and tips for your application. But let's start with what is physio. So most of the time people think about seeing a physio run onto a football pitch when somebody suffers an injury from playing sports or potentially low back pain, for example. And they are really key parts of physio, but there is so much more to it than that. Physiotherapists use movement and therapeutic exercise to help patients restore their functional activity and also improve their quality of life. We take a holistic approach. We're an evidence-based profession, but we take a holistic approach to our patients with an ultimate aim to improve their well-being. We work in so many different areas. So as I mentioned, there are sports injuries where physiotherapists work in sports teams, or for people who have suffered an accident and, for example, may have a broken bone or multiple broken bones. We also work with people who have cardiac, so heart conditions, or they may have problems with their respiratory system, so a condition with their lungs, for example, chronic obstructive pulmonary disease or cystic fibrosis, just to name a few. We also work with people who may have suffered a neurological event, for example, a stroke or a brain injury, whether that's a brain injury from not having enough oxygen or a traumatic brain injury. We work with people who may have had a spinal cord injury as well. And then just sort of another area, and this isn't by any means exhaustive, but another area is women's and men's health, where people may be having issues with continence, so bladder and bowel function. And we work with people across their lifespan. So we could be involved with people from the moment they are born all the way through to their end of life care and everything in between. So it's very, very varied in who we might see, the different people that we might treat. We also work across a variety of settings. So there are some physiotherapists that would work in an outpatient clinic or in a hospital within a ward setting, or an intensive care unit setting, through to helping people stay sort of in their own homes in the community. There are other areas that physios can work as well, such as education and research. So that hopefully gives you a bit of an overview of what physiotherapy is. So what is it actually like working as a physiotherapist? It is an incredibly rewarding job. We help people improve their quality of life. It can be hugely rewarding, and it can be challenging. It's a busy job. It will always be keeping you on your toes, and there isn't time or space to be bored as a physiotherapist. And it is a caring role. We are caring for the general public. It's the career that offers huge variety in terms of working location. And so this is both in relation to whether you're working sort of in a hospital or in the community, as I mentioned previously, obviously any area across the UK, and also internationally. It's an international profession. You also have a chance to work as part of a healthcare team. So physiotherapists very rarely work on their own. And it's all about offering our own very specialist knowledge to that team to give the patient the best possible outcome. We are autonomous practitioners. What that means is that we use our clinical reasoning to assess what is happening with somebody and make a diagnosis or recognize what the problems are. And then we choose the treatments alongside the patient that will most effectively manage those conditions. So we aren't told what to offer treatment-wise to patients from other health professionals. It's more of we hold that autonomy to make that decision ourselves, but obviously with the patient as well, both developing the most appropriate treatment plan for that particular individual. And it's a very practical, hands-on career with scope for further professional development. And physiotherapists can work sort of in more of a policy role, for example, working for NHS England or Health Education England. You can choose to work as a senior clinician and just develop your clinical skills further. Like myself, you can choose to work in education. So again, obviously I'm going to advocate that route because it's so rewarding, helping to develop the next generation of physiotherapists. Physios can work in research as well. So finding out actually, what is the best treatment that we can do for this patient? How should we be approaching this particular condition? And that's just to name a few. We have much more sort of advanced roles as well, such as our first contact practitioners. So it just kind of gives you an idea of actually that there is huge scope. You will never stop learning, and there is always further to go with this profession. So what to expect from studying physiotherapy? Obviously, this varies from course to course, but essentially most physiotherapy courses will have this in common. It is, there are hands-on techniques that we use in physiotherapy, so it is a practical hands-on career, and so we have practical sessions. And this can be quite different for people who have never experienced that way of learning before, where you are getting hands-on experience with each other, with other students, and students are generally asked to model for one another within those practical sessions. There's a lot of group work involved as well. As I mentioned previously, we rarely work in silos as an individual in physiotherapy. We do work within teams. And so it's really important to develop those group work skills from a very early stage. We have lectures as well, and we try to make those as interactive as we can and engaging. There's a combination of sort of online learning packages as well as face-to-face. And another aspect that every course will offer is 1,000 hours of placement. So what this means is that within the course itself, within that 3 years or 4-year degree or 2-year masters, if that's the route you're choosing, there will be 1,000 hours where you are out on placement in the workplace, working under the guidance of a qualified physiotherapist. And this gives you an opportunity to really apply all of the learning that you've been doing in university to real life patients. And it gives you that real experience of thinking, okay, that's what I've learned in theory, and now I can apply it in practice. Whilst all of the courses have slightly different ways of ensuring that you then meet the requirements to become a qualified physiotherapist, essentially all of the courses will then allow you to be eligible once you've qualified for registering with the Health and Care Professions Council. And it's at that point you can call yourself a physiotherapist. So that's the HCPC who regulate physiotherapists. You can also join the professional body for physiotherapists as well. So that's the Chartered Society of Physiotherapy. And you can join them as a student physiotherapist and then as a qualified physiotherapist once you qualify. And they offer all sorts of support and advice for physiotherapists across the UK. Entry criteria do differ from between institutions. So this is just an illustration that I've been able to provide that's in line with the University of Huddersfield entry criteria. But essentially most physiotherapy courses will be looking for an aspect of biological science. And so here at Huddersfield, we ask for ABB at A level to include a biological science, so either biology A level or PE. If you're studying a combination of level 3 qualifications, we ask for 128 UCAS tariff points. And so that would also need to include an A level of grade B or above in either biology or PE. We do accept BTECs as well, and we ask for distinctions in BTECs. At Huddersfield, we are a bit more specific in which BTECs we will accept. So I really would urge you to make sure you do visit the university you're interested in to see what their criteria are, as we would accept sports and exercise science or applied science as a national extended diploma. And then we have access courses as well, where we ask for 30 of the credits to be passed at distinction and that 21 of those distinctions are in a biological science. So for us at Huddersfield, we're very keen on the biological science aspect, and that's reasonably common across all of the courses. We also ask for GCSE maths and English at grade 4 or C, or the equivalent for functional skills as well. So application hints and tips. Most courses will ask you to attend an interview prior to offering you a place. We want to get to know you. We want to hear what you've got to offer rather than just judging off your personal statement. And some of the things that we look for are really an awareness of the profession. So being aware of the breadth of the profession, the skills that you might need, the qualities that physiotherapists might need to be successful. And one of the things I think is also very important is just to research the university and that specific course. As I've mentioned, all of the courses are trying to get you to the same end point where you can then be eligible for HCPC registration. But every course approaches that in a slightly different way. So it's around having a think about, what is it about this course that suits me and the way I learn? Why am I so keen to study at this particular institution? Do check the course entry requirements. As I said, there is some variability across different institutions. And we're also interested in knowing what your values are, and do these align with the NHS constitution? It is a caring profession. So we are wanting to see, do you have values that are aligned with being a physiotherapist and caring for the general public? So finally, I just wanted to say a little bit about why physiotherapy is such a great career. So if you are thinking about it, just to really urge you to take that leap, because it's a step that you won't regret. There's huge variety, as I mentioned earlier, just around the different types of patients we might treat across the different stages of their life that we might treat them. So you can never be bored. There is just such a breadth in what we can do. There's huge flexibility as well. So if you're not so keen on a particular area, you can then choose to specialize in another area. You can choose to stay very generalist, and that has its own merits as well. And so it's very flexible in the approach that you want to take to the rest of your career. And you're not you're not pigeonholed down a particular route. There is flex within that. So if you change your mind after working in a particular area, there is always a way of getting that exposure to working somewhere else within physiotherapy and still being a physiotherapist. There is huge job satisfaction, knowing the difference that you can make to your patients' lives and seeing the impact that you're having as a physio on that patient is massively satisfying. And that can, even when it's been a hard, busy day, you still get that job satisfaction at the end of it, of knowing that you have made such a difference. And then finally, one of the things that I think sets us apart from some of the other health professionals is that you tend to get some time with your patients. You get to know your patients. You get to know sort of what their preferences are, what they are really aiming to achieve, and then tailoring what you're hoping to do treatment-wise with them to make sure that it's appropriate for them. So we do have that time to actually get to know them. So that's everything that I wanted to share with you. Thank you very much for listening, and I wish you all the very best of luck in your choices and studying physiotherapy.